Hello, I'm Dr. Erica R. Jones, MD, and I'm a board certified family medicine physician who is here just to ask you for 5 minutes of your time to discuss colorectal cancer. Now, I know you have probably seen my YouTube short where I talked about the rates of incidence and mortality that African Americans have, and the fact that they are really alarming, right? Because African Americans have uh, 20% higher rates of incidence of colorectal cancer, and African Americans have about 40% of a higher mortality rate from colorectal cancer than any other races in the United States. So, thank you for tuning back in to find out more information about colorectal cancer. It affects all Americans. And excluding skin cancers, colorectal cancers are the third most common diagnosed cancer in both men and women in the United States. So understand that colon cancer is prevalent and awareness must be made. It is important that we talk to our healthcare providers about our risks because there are some people who are in a high risk group versus those who are in a normal risk. And if you don't know, it's important to talk to your healthcare provider about it. So I'm just going to go into a few details about the different risk groups, right? So this list of high risk individuals is not exhaustive, right? I'm merely giving a few examples and letting you all know that there are certain individuals who are in the higher risk category. So anyone with the inherited syndrome called Lynch syndrome is going to be at a higher risk for colorectal cancer. So, if you have been diagnosed with Lynch syndrome, then it is important that you follow up with your primary care to talk about colorectal screening, right? And then there's individuals who have an inherited disease called FAP or familial adenomatous polyposis. Those individuals are also going to be at a higher risk of developing colorectal cancer. It's important that people get screened early so that way you can what? Catch it, right? Catch it early and hopefully um, get treatment. A few other risk factors that we can change: obesity, uh, and alcohol use, as well as type 2 diabetes. Those are other risk factors for developing colorectal cancer. So, here are a few red flags that you need to be aware of, um, which might prompt you to go to your doctor and, discuss some issues with your colon, things that you need to look out for. Number one, any type of persistent, rectal bleeding, right? That's definitely something you need to look out for. Changes in your stools, like if you're stool normally just comes out in a long cylindrical form and then you notice that it is narrowing in shape, that's something that you need to look out for. And another thing is any blood in your stool, right? So if you know that your stool is normally brown and then it starts coming out and it's black or it's blood tinged, that is something to note. It is something to pay attention to, and you need to make an appointment to see your healthcare provider and talk to them about it. Ask them if they think you need an appointment with a gastroenterologist. That is the GI doctor, and that is typically the healthcare provider that is going to be performing a colonoscopy, um, which we use to diagnose different issues as far as your colon is concerned. Now, it is important to note that there are steps to getting a colonoscopy. There are certain things that you have to do before getting a colonoscopy, like cleaning your colon out. That could involve taking different types of medications that will have you going to the bathroom to clean your colon out before your actual procedure. During the actual procedure of a colonoscopy, a scope is going to be placed inside your anus, and the scope usually has a camera on the tip of it that allows the physician to be able to see what's going on in your colon. Okay, so this is not just a short thing. There are steps that have to be taken to actually get the actual colonoscopy.